Hi, I'm Jenny Backus from HHS Public Affairs. Welcome to our web chat on health reform. Today's web chat is the first in a series of discussions that we'll be hosting here at HHS, the Department of Health and Human Services, as we work to implement this new health care reform law and ensure health security for all Americans. Our healthcare system wasn't broken in a day, and it won't be fixed in a day either. This is going to take a lot of work, and we want you, the American people, to understand the process both today and in the years ahead. We know that many of you have questions and will have questions in the future about this new and complicated legislation and what it means for you and your families. In the months ahead, we'll be here to answer your questions directly during our web chats or on our website, healthreform.gov. Earlier this week, we asked you to submit your questions, and today we'll try to answer as many as possible. But we'll be holding these conversations regularly in the months ahead. So if we don't get to your question today, we'll make every effort to cover it in a future webcast. We'll also be answering some of the most frequently asked questions on our website every day in a special section called Your Questions Answered. That's at healthreform.gov. So keep checking the site for more information and updates. Today we're going to be talking about how health insurance will immediately benefit Americans, especially our small business owners. I'm joined today by Health and Human Services Secretary Kathleen Sebelius and Small Business Administrator Karen Mills. Secretary Sebelius, let's just start right off. How does this bill help everyday Americans? I've been hearing so much about it. How does it help people?
Well, the President and Congress in the comprehensive legislation provided, I think, an opportunity for all Americans to have some health security. For those who have insurance, it will help lower costs over time. It will help drive higher quality care over time and give people some stability with their insurance costs. For those who don't have insurance coverage right now, there's a short-term progress made toward that, and then eventually a new marketplace with leverage and competition, purchasing power that folks don't have. And once and for all, the insurance rules change. So no longer do insurance companies pick and choose who has coverage and who doesn't.
Well, we have the administrator from the Small Business Association. One of the first benefits that I've heard, and we've seen a lot of people talking about, is small businesses. So how do small businesses impact from this new legislation?
Well, first, I'm delighted to be here, and thank you for doing this to answer the questions of small business. You know, healthcare is the #1 concern of small businesses. And in the surveys, it's been the #1 concern since 1986. How do they get access to affordable health insurance? You know, right now, small businesses are paying 18% more for health insurance when they can find it. And about half of the small businesses between 3 and 9 people out there really can't find a quote that they can afford. And so now, with the passage of health care reform, we're going to be able to provide more opportunity, more access, more affordability.
Well, there's a lot of talk when they talk about the first thing that's coming out of the box for small businesses on this tax exemption. So what do they need to know about the credits, the tax credits, that will help them get coverage for their workers?
Well, to all the small businesses out there, this is very important because tax credits are available this year in 2010. And there's about 6 million small businesses out there that have employees, and 4 million of them, 2/3 of them, are going to be eligible. So if you're a small business out there right now, it's very important to check this eligibility. If you have 50 employees or fewer and you meet a wage guideline, you may be eligible for this tax credit this year.
Is there anything else on the business front? We're going to get to the viewers' questions in a second. Is there anything else on the top end that people need to know in terms of credits, or should we just go right into the questions?
Well, there also is some help this year for those companies who help cover their retirees. Sometimes if you're a small business, 1 or 2 retirees who is in a very ill shape can totally blow up your affordable insurance rates. So there is going to be a high-risk pool set up and some help for business owners who are trying to do the right thing, who are helping to pay for their retiree coverage and help to lower those extraordinary costs.
Great. Well, I think we have a lot of questions that sort of touch on both of these, so let's go right to them. And what we're going to do in the rest of the section is just go through some of the questions that we got. Just so you all know out there, we got over 600 questions for this web chat. I'm not going to make our guests answer 600 questions.
Several days.
But we tried to sort the questions into categories, and we hope to cover as much ground as possible in the short time that we have. And in the coming week on our website, healthreform.gov, we're going to introduce a very cool feature just in time for Open Government Week that allows you, the public, to vote on the questions in future web chats that you want answered most. So we'll get some more input for you. Today we just took the categories. And every day we're also going to be posting a new question from the ones that we're getting into the mailbox. And you can check out your answer, new question every day on the website. And also, as I go through this tonight, as we ask the questions, we may paraphrase them slightly from how you sent them in to save us some time. So let's start with a question. Our first question comes from Maria from California. And Maria says, my family and I already have health insurance through my employer. How is this new bill going to affect me? Secretary, you want to take that one?
Well, I think, Maria, there won't be a big impact. The coverage that you have will stay in place through your employer. All the plans are going to have preventive care with no copays. So as the plan gets renewed, that will be a change. The insurance companies will redesign the plan to make sure that preventive coverage will be provided. And hopefully you'll see less taken out of your pocket over time, because we hope that comprehensive health reform will help lower costs for everybody, take some of the administrative overhead out of insurance costs. So this should be a benefit, but it should stabilize the plan you have.
Great. Norris wants to know, when is the pre-existing condition going to start for children, for adults? He says he's heard that children will start in 6 months and adults in 2014, and if so, why is there a difference?
Well, Norris is partially right. The parents, there's good news on the way. Insurance companies this year, starting in September, will have to include children with pre-existing conditions on their plans. Any cancer survivor, an asthmatic who might have been medically written out of the plan, or the treatments weren't covered, that will change this year. For adults this year, there will be a high-risk pool. There are adults with pre-existing condition who literally have no insurance because no one will give them a quote. So we are helping states set up pools where there will be insurance available. In 2014, when the brand new markets exist, all the restrictions about pre-existing conditions will change. Every company will have to offer policies to everyone with a pre-existing condition, and there'll be a new marketplace where companies will have to compete for your business. So it's help immediately for kids across the board, help in a high-risk pool for adults, and then a new market for adults when we get the exchanges set up.
Great. Richard has a question that I think, looking at it, might be for both of you. So just you can take your time. Okay. Richard says that the subject of congressional exemption to the new healthcare reform and the hiring of 16,500 new IRS employees to administer healthcare reform are hot topics at our morning coffee club. I've checked Fact Check, which denies both of these claims. However, this doesn't seem to satisfy some of my members. Can you clarify this? So maybe you can do IRS agents and you can do exemption or whatever you want.
Well, I believe that Fact Check is correct, that these are these IRS agents have not been hired. And you may want to.
And it's not assumed that they will be hired. The exemptions are basically, as I understand it, being run through kind of existing systems. So, unfortunately, over the course of this debate, lots of back and forth, lots of misinformation presented as facts at every step along the way. So, one of our jobs, and it's why we're having the web chat today, but we'll continue to do that. I'm really glad Karen Mills is here to talk about the business piece of this, is to tell people what actually is in the bill and what isn't in the bill. So glad you asked the question, but it's just not true.
Great. And the same for the congressional exemption? I just want to hit that, too. Good.
Yes, that's absolutely true.
Selena wants to know a question for, I'm going to direct it to you, Administrator Mills. I want to know what this means for small business. You've already hit that a little bit. Are we going to be required, she wants to know, are we going to be required to provide health insurance for our employees?
Well, once again, this is one of these pieces of not factual information that's been out there and I think has frightened a lot of small business owners. there is no mandate that you have to provide health care insurance. The way it works is if you have 50 employees or fewer, you are exempt. There's no issue at all. If you have 50 or more employees, and one of your employees does go in the exchange as an individual because you do not provide health insurance, then you are required to pay back the credit, the government subsidy that that person will have used as an individual, and you're required to do that on a number of your employees. Not all 50, but those that you have, I think it's above 30. So you will need to participate. It turns out that there are very, very few businesses to which this will apply. There's about 6 million small businesses, as I said earlier, and 5.8 million of them are below 50 employees. And of the 200,000 that are left, most of them actually provide health insurance right now. So this issue, which we call employer responsibility, that you're responsible to pay back something if you don't provide health insurance, only will apply to 10,000 small businesses.
I think you're touching on the topic of our next question, but because we don't have the information from Deanne. Deanne from Texas said, never know where we fall in regards to small business. Can you give me a definition? You just did. Is there anything else you want to, if you were a small business owner sitting somewhere in terms of definitions, or any other thing that small business owners need to know in terms of categories?
Well, if you've done anything with the Small Business Administration before, you'll know that we have other definitions for small business. So you are eligible for our loan programs up at different levels. But for the purposes of the healthcare tax credits and the healthcare employer responsibility costs, the cutoff point at this time is 50. And so that would be relevant for this question.
Yep, and I wish I knew how many who could have helped Deanne get a better answer, so we'll try to get more details next time. Jeff wants to know, how is mandating everyone in the U.S. to purchase something from companies helping out the country? You want to take a first crack at that, Secretary?
Well, currently we have a system where most people, at least who have contacted us and we've talked to across the country, would like to have the security of health insurance. Some can't afford it. Some actually are pushed out of the market because of a sickness or illness. So step one is to change the rules. But step two is to really say, if the system is going to work, insurance is about balancing risks. So we need people who not only are sick to draw benefits, but also people who are well to be in the system, or you don't have health insurance at all. And I think part of what the President has said is there is some responsibility. Administrator Mills has just defined the employer responsibility. There is a individual responsibility that gets waived if you cannot afford still insurance coverage. You get help from the government to help purchase insurance coverage, and it provides some stability and security. Right now, we have people who, for instance, don't buy insurance if they are in a car accident or a motorcycle accident, come through the doors of an emergency room, and everybody, whether they buy insurance for their families or not, pays that cost. It's about $1,000 on everybody's health policy to pay for the people who don't have coverage. So right now, a lot of families and business owners are actually paying extra, not only for themselves and their families or their employees, but for lots of people who, frankly, could afford it but have chosen not to get it.
Okay. Walt has another question about health insurance companies. Walt's from Florida. He says, health insurance companies are telling the media that folks can expect to see huge increases, large increases in insurance premiums, now that there are new regs allowing for greater coverage. We were told that premiums would decrease. So what's the answer? He wants to do.
Well, I think the answer is, first of all, we'll have a much bigger pool. That's good news. So you'll balance some of the sickness and the people who draw down more benefits with people who are not so sick. It's part of having a larger purchasing pool. But secondly, A lot of the underlying pieces of the plan are actually about health and wellness. Having health insurance often lets you get into the health system at a much earlier stage. So before you have a chronic disease, before you have an illness, before you come through the doors of an emergency room, to access health and wellness, to keep people healthier at the front end, which definitely does lower costs. So I think on balance, you know, what we have right now is most people get health care, but often they get it at the most expensive, least effective time. We want to make sure that we begin to shift those costs around. And we have new oversight over insurance companies. Insurance companies recently sent notices out across this country that they were raising rates 30, 40, 50, 60% after filing huge profit statements. The new law says most of the money that they take in the door has to be paid out in health benefits, not CEO salaries, not advertising costs, and we'll actually be able to get that information and measure that moving forward. We'll also make companies in the new market compete with one another. They can't pick and choose their customers and then in a monopoly, which we have right now in many markets, just keep raising those rates. There'll actually be some competition.
Now, this has really been true for small businesses. They have suffered enormous rate increases. So as we've been traveling around the country, sometimes small businesses will say what increase they just got. It's always double digit, and sometimes it begins with a 3 or a 5, or one poor small business said, you know, it was a 9. And they really have no options because they can get very few quotes. So a small business will go to a broker, maybe get 1 or 2 quotes. Very, very difficult for them to get what they're going to be able to now access in the future, which is an exchange, a marketplace where their risk is pooled and they have the leverage of what big businesses have. Yeah. This 18% premium they're paying now is just because they're small and they don't have enough people to disperse the risk. So we are looking to see costs go down for small business and access go up. And I think the first estimates are, you know, at least a few % down as opposed to these huge increases that they've been seeing.
Now, we're talking about, you know, mandate in a bigger market. One group that has been traditionally underinsured is, or has not gotten insurance, are younger people. And Renata from Arizona has a question about this. Is our unmarried daughter, age 21, who is graduating from college on May 8th, 2010, so congratulations, Renata, is she going to be covered up to the age of 26 now that the president has signed the health care bill?
Within 6 months of the president's signature, which was the 23rd of March, so we're talking about the 23rd of September, policies will cover dependents up to the age of 26. That's very good news. I mean, in my case, our 2 sons, when they graduated from college, were not headed into jobs where they had health insurance. We were lucky because they're both healthy, and we were able to help them out, find policies that were relatively affordable. They had friends who weren't so lucky. So a couple of friends decided just to take a risk, and that's a very dangerous place for a family or a young person to be in, where you are a step away from having what could be a lifetime of debt. So the good news for families, again, congratulations to the almost college graduates out there. That's great, but you won't have to lose your health insurance coverage this year.
Okay. Sticking in the Southwest, I think, Kenneth has a question, and I want to give this to the Administrator Mills. My sister has a barbecue restaurant in Texas. She only has 6 employees.
That's exactly. A great idea.
Does this new health care reform bill require her to provide insurance? She currently doesn't have it because she's in a very small business market, but she wants to know for the future.
Well, this is exactly what we were talking about. And in a barbecue restaurant in Texas, I hope she's got plenty of business there. But with 6 employees, she will not be required to buy health insurance under this new reform. She will, however, have some opportunity. She will get a tax credit, which could be 35% of what she's spending, And when the exchange is open, she will be able to go on the exchange and assess. Maybe there's going to be different levels of policies available, and hopefully find one that's affordable. One thing we do know is when employers want to provide health insurance. They know that it makes for more employee longevity, that employees will stay with them. And small businesses are like a family. If somebody gets sick and they don't have health insurance, there's enormous cost, emotional and financial cost, on the small business and the small business owner.
All right, we've talked about small businesses. Melanie from D.C. wants to talk about self-employed. How are self-employed people treated under the health care bill? Do they qualify for small business tax credits, or will they get individual tax credits instead?
Well, I think that they certainly will be eligible for the new marketplace. If the self-employed person has a pre-existing condition, they can get some immediate assistance before the exchange is set up. If they make below a certain amount, they'll eventually get a subsidy to help purchase insurance coverage. In terms of eligibility for a tax credit to buy their own coverage,
They're going to be covered as an individual. If they're not an employee, a firm with employees, the best way for them in this is to be treated as an individual and have the benefits, which will be tax credits and accessibility to these exchanges as an individual.
Great. We're going to switch off that topic and go to public health. Andrea is a public health nurse.
Good for you, Andrea. We need more. Anybody listening out there, this is a great profession.
How does reform affect public health? Will local health departments lose funding as a result of reform? And what will public health look like from now on?
Well, first of all, there is no loss of funding. We hope that it will help stabilize the public health, which is such an important component of our, frankly, health security in this country. There's a major investment in community health clinics, which are important healthcare delivery systems that often operate in underserved areas to reach out to folks, and that continues to have an investment. There is a major investment, which was started in the Recovery Act and continued here, in healthcare providers. So more scholarships available for future doctors, for nurses, for nurse practitioners, for mental health professionals, for behavioral health folks, recognizing that we need more providers to take care of folks in the system. So I think there are a series of areas where public health infrastructure is actually strengthened by this moving forward. And we hope in the long run that there will be less inappropriate demand on hospital systems, and more people will have a health home to begin with. More people will have the care providers, will access primary care and preventive care. Again, I think such an important aspect of a public health initiative is to keep people healthy in the first place and not wait until they get sick.
Okay. Larry has a question. He's a senior. I'm a senior who is already in the gap in the Medicare prescription drug coverage known as the donut hole. Will the rebate of $250 be sent to me automatically, or do I have to apply for it, and how do I do that?
Well, Larry, we are developing the very specific rules right now, but this year the $250 will be sent the quarter that you sort of hit that gap in coverage. So if I understand it correctly, if you're already there, and we're only in March, by June you will get a $250 check, because that will be measured by our Medicare system. For those who may hit it later in the year, there'll be additional checks going out in September that will take care of that. And over time, the donut hole will be completely closed, so you won't be facing that kind of gap any longer. Next year, about a 50% decrease in the generic drug cost begins to take effect, and we'll move on from there, but the gap is closed over time.
Okay, we just have time for a couple more questions. I want to go to William next. William is worried about the financial obligation that the states are feeling. What will be the financial obligation of the states during health care reform? This is in relation to higher taxes for all if the states have too much of a burden.
Well, William, that's a great question. And as a former governor, I was very sensitive to that question. I would say that, first, this is one of the most state-friendly bills I've seen coming out of Washington in a long time. And the president understands the burden on states right now. Nothing is imposed on states. No additional coverage is expected until 2014, when the new marketplace hits. And at that point, it's 100% paid for the first 3 years by federal dollars. So we're out to 2017 for any kind of coverage expansion, even a portion of which would be picked up by the state. Over the course of the bill, it's a small fraction. It's less than 10%. In the meantime, states are seeing a lot of benefit. The president, in his budget this year, has an additional $25 billion for states to help provide care for folks who already have it. There's additional coverage and costs for children's health insurance. There's additional money in the bill for the drug rebates to states. There is investment in primary care, in costs that right now states pick up in uncompensated care to hospitals. So on balance, we feel very strongly that actually most states will be winners as a part of this program. There's more investment in health aspects in states than there is any kind of requirement, and none of those requirements hit until we are well down the road in terms of the implementation of this bill.
Okay. I'm going to give one more question. I'm going to ask each of you for just a quick final thoughts, and it's from Ohio. I have to go back to your home state here. Cindy wants to know, what's the state of Medicare Advantage plans in the health reform legislation? If they're no longer available, will anything take their place?
Well, first of all, Cindy, again, this was a point of a lot of misinformation, and I would suggest intentional misinformation. Nothing does away with Medicare Advantage plans. We anticipate that this will still be a very vibrant marketplace, and, you know, companies move in and out of that marketplace, have for years, but we think that they will still very much be available. What's going to stop over time and gradually phase out is the overpayment to insurance companies for Medicare Advantage plans that, frankly, is paid for by the seniors in Medicare. Companies providing Medicare Advantage plans are chosen only by 1 out of 5 seniors. Everybody pays a higher cost, and they don't deliver higher health benefits. So over time, Congress has said we need to decrease the overspending, but Medicare Advantage plans will very much be available as a choice for people who don't want the traditional Medicare services.
Okay. We have 30 seconds left for each of you. Anything finally that you want small business owners watching tonight, or just any American or people from your home state of Maine? I think you're going there tomorrow.
I'll be there tomorrow with the president. He's going to talk about health care in the state of Maine, and we are pretty much a state of small businesses, so we're looking forward to it. This is a very critical bill for small businesses. It addresses their #1 concern, and as the Secretary said, we need to make sure that small businesses understand what this is going to do for their costs right now. You could be eligible for a tax credit if you're under 50 people and you already provide health care. So keep your eye out for that. You can come to our website, and I know there's a number of other information websites, and we can make sure that if you're eligible, you can get the credit.
Great. Anything else from you, Secretary?
Well, we will be trying to get information as quickly as possible. The steps of this bill are first to get the benefits for 2010 outlined clearly, and to make sure Americans know that they're coming, starting with the small business tax credit, which is a great benefit. And I think that this is no question that it will have a very positive impact on families, on business owners, on seniors, benefits that we hope will keep people healthier and keep our nation more prosperous.
Well, great. That's all the time we had today. I want to thank you both for joining us. Secretary of Health and Human Services, Kathleen Sebelius, Small Business Administrator, Karen Mills. We hope you got some of your questions answered today during the webcast, and we're going to be making it available on demand shortly. And soon it will be available as an archived webcast at our website, which, as you all know, since you're watching this on it, is www.health healthreform.gov, and we keep all of our archived videos there. We'll be back next week, and we hope that you'll browse the site and find everything else that you need. I'm Jenny Backus, and we'll see you next time. Thank you.